ACU-Track have partnered with researcher Lisa Taylor Swanson to study the changes in interoceptive awareness following acupuncture and traditional East Asian medicine treatment. This is an exciting new research project which uses a questionnaire called the Maya-2 to monitor in-depth changes about how a patient feels in their own body. All ACU-Track users can now use this questionnaire in the Interoceptive Awareness Plan. You can find this plan under Patient Outcomes Plans in your ACU-Track account.
Good day, everyone. I'm Dr. Lisa Taylor Swanson. It's a real pleasure to talk with you today about interoceptive awareness. I'm going to give just a brief introduction of what that is and why we're collecting this information with ACU-Track. So interoceptive awareness is basically how we feel our body. So right now I have a little tension in my back. I'm noticing that. But interoceptive awareness also includes our emotional sense of ourselves. So I might feel kind of anxious about, oh, what is that pain? Is it coming back again? Or I might just feel very calm about, oh, there's another hot flash. So interoceptive awareness is literally being embodied. It's how we feel our body. And why is that an important concept for acupuncture and traditional East Asian medicine? Well, I can say as a clinician of 20 years, I've been treating patients. In the last decade, I've been researching our medicine. Interoceptive awareness, I think, is a key mechanism of action. I think it's a part of how acupuncture works. It's a part of how the whole intervention of our medicine, with clinicians talking to patients, educating them about their symptoms and self-care, providing acupuncture, cupping, gua sha, what have you. Because I think that acupuncture and the whole intervention that we deliver really helps our patients be more trusting of their body, to notice sensations, to not freak out about them, to be more balanced in their body, you might say. We're always trying to balance the chi, right? So there we are. So what we're doing with ACU-Track, with our EHR system here, is to utilize a measure called the Maya. It's the Multidimensional Assessment of Interoceptive Awareness Scale. It's validated, used widely. And there are several domains that we think, again, that acupuncture and our intervention as a whole medicine will improve. So the domains of the Maya are noticing. So do we notice that we feel comfortable or uncomfortable in our body? We feel our bodily sensations. If we're able to not distract, if we can actually be with sensation versus, oh, I feel pain, I have to go, it could be distracting ourselves with a really maladaptive behavior like an addiction. Oh, I have pain, I have to go take an opioid. Or I'm anxious, I've got to go eat something. No, we want to help our patients not have to distract themselves, and they can just, again, bear witness to be with those sensations, to not worry, to just realize, oh, I'm noticing is another one of the domains that I was just mentioning, to really be able to regulate their attention, to just be with those sensations, again, to not have to hurry and distract oneself or take one's attention away from the lived experience that is their body. And body listening is another domain. It's actively listening to the body for insight. So, oh, there's that kind of butterfly feeling I have in my stomach again. That's when I know I need to go have something to eat, or I'm nervous or something, but they're actively listening to the body. And lastly, trusting those sensations. So, if I have pain, that I trust that sensation versus getting anxious about it or judging it or that kind of thing. So those are the domains of this measure. Your patients would be answering questions regarding these various domains. And then you might be wondering, well, gosh, which patients should I have this bundle be a part of, or ask them to fill out this questionnaire? And the short answer is everyone. It matters for every patient, but most especially for any of your patients with pain, whether acute or chronic, with any kind of mental or emotional disorder, if they're experiencing anxiety, depression, if they're super stressed out and can't manage their stress levels, think of including this for that patient. So thank you for your attention, and we look forward to learning from you and your patients.
You can initiate a patient on the Interoceptive Awareness Plan just like you would use any other plan. You can also use this plan in combination with another. For example, you can initiate a patient on the pain plan as well as the Interoceptive Awareness Plan at the same time. Click Save to initiate both plans. You can complete the baseline questionnaire in clinic with the patient by clicking the blue Patient Portal link under the left-hand menu. Alternatively, the patient can complete these questionnaires remotely via email. The Maya 2 measure is slightly longer than some of our other plans, so just make sure your patient is happy to spend a little bit of extra time completing this questionnaire, and allow a little extra time in clinic to spend on this. As with our other plans, your ACU-Track account will automatically send all interoceptive awareness follow-up questionnaires to the patient via email at predefined time points. This allows you to monitor and track changes in the patient's pain and interoceptive awareness over time. You can monitor a patient's progress in real time in clinical scores. You can monitor overall changes in interoceptive awareness, as well as monitor a breakdown of changes according to the various subdomains, including noticing, distraction, worrying, attention regulation, emotional awareness, self-regulation, body listening, and trusting. You can also monitor a patient's pain score and the overall improvement of their health complaint here as well.